Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.
Good evening. Welcome to Mental Health with me. I'm Steve Belcher.
And I'm Sade Culter.
Hey, what's going on, Sade?
Hey, how you doing, Steve? How you feeling?
Pretty good. Great. I'm so excited to be here this evening with you.
I'm excited. Thanks for having me.
Absolutely. Well, you're the host. You're the co-host.
Thanks for having me co-host.
Yeah, absolutely. Absolutely. We know how important mental health is, and especially in the business that you work in. So before we start the show, tell us a little bit about MEI, because you're CEO of My Empowering Impact, which is kind of like mental health, and you do education. Share with us what you do with MEI.
Okay, so MEI stands for My Empowering Impact, and it is an organization that supports mental health and wellness. We provide therapy, education for social workers to get their continuing education credits. We also do coaching for people that just need like a little bit of guidance or support, but not quite ready for therapy. We also we also have, which was just launched recently, a place called the Alms Shop, and that's our way of giving back. And it's where people can go and get free items that are in need, that are poor, and they get to shop for free. They just have to pay the shipping fee.
Hmm.
So that's what we're doing right now.
Right, right. Now, Sade, just answer this right quick for me. Why is there a stigma around mental health? I mean, why don't people like to talk about it when, in fact, talking about it will probably be the most rewarding thing you can do?
You know, a lot of people have grown up with the understanding that if you are having any mental challenges, that you are considered crazy, that something's wrong with you, that uh, that you should be strong enough to be able to control yourself or control your emotions. So when people actually have to seek help, they look at it as actually admitting that there is something wrong or that they have a problem, and that is closely aligned with the stigmas that you see around people really not wanting to get the mental health that they need.
Sure, absolutely. And I mean, I can't tell you guys how important this show is. I mean, it's only 5 people on here, but that's okay. It could be one. We're going to still put that information out there because people can always go and look back. But I know, and Sade, you know that, I mean, mental health is a big, big deal. And I mean, a lot of people are affected in some way or another, maybe trauma, whether it's relationship abuse, anxiety, depression. And tonight we just happen to talk about that, dealing with chronic kidney disease and mental health. But I mean, I haven't seen any shows. I mean, I've seen webinars of,
Mm-hmm.
institutions maybe talking about mental health, and they may have a psychiatrist on there or psychologist, and they talk these fancy lingo and stuff like that. But there's no show, no weekly show that we're going to do where each week uh we try to give hope and information pertaining to mental health to people who may seek that information. I mean, I also want to create this platform as an outlet for people who may just want to express themselves on the feed.
Mm-hmm.
And you won't be judged if that's the case, but we want this platform to be just that. What do you think, Sade? What is your hope for this show?
My hope is that people will look at it as a supportive show to watch, like you said, to have get some education and just some vital feedback. It's not, of course, an actual therapy forum,
Sure.
but it's an opportunity for people to just ask questions and inquire about things that they may have been scared to ask before or actually talk about.
Oh, and I'm glad you said that right quick. Let me just do this disclaimer. Thank you for saying about, uh, with that being said, this is an education disclaimer. The information broadcast on mental health and me is provided for educational and informational purposes only and is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. So, with that being said, I got to get that out the way because I don't want anyone to think that that's what we're trying to do. We're talking about it. We're using evidence-based information that's online, peer-reviewed articles that talk about this stuff. So we're just discussing it. We're not telling you what to do or what you should do, but just talking about the topic and raising questions and solutions to common questions that are raised pertaining to chronic disease and mental health. So with that being said, I want to put up right quick with this show as well. We want to also put up the suicide hotline number because we don't know what anyone is dealing with. Sade, touch on just a teeny bit about suicide and chronic disease. Why would somebody want to commit suicide if they had a chronic disease or a terminal illness?
So when people are diagnosed with a chronic illness, that is what we consider a life-changing event. Many people don't know how to cope when certain diagnoses are given to them, like people that are diagnosed with cancer, end-stage renal disease, even diabetes, lupus. It's a ton of things that people are diagnosed with, and they don't know how to really handle it. So with something as serious as dialysis treatment, it requires you to go 3 times a week, or some people may have to stay on longer than others. It takes so much out of you that people sometimes just don't want to do it anymore. And that's when you start to come into those people that talk about ending their lives, talk about not wanting to go forward with treatment, which we also know that not getting treatment for dialysis is also looked at as an end of life sentence. So those are the things that start to happen when you are diagnosed with a chronic illness and you just don't want to, you're just not ready to deal with it or accept it, or it's tiring.
Mm-hmm. Now, with that being said, quick question before we start. And Reynaldo Alexandra, host of Finding Your Will to Survive, he make this statement. He says, many people are dealing with mental health issues and aren't even aware of it. Is that true?
Absolutely. Sometimes you ever have a conversation with someone and they are just down, their mood is just really dark. It just seems like they are just going through, but they might say, oh no, I'm just fine. But everything after it looks like everything about their energy, about their face, about their behaviors show that they are not fine, but their mouth says that they are fine. Also, people that think that they're handling their mental health pretty well are sometimes not really getting the actual help that they need. Sometimes it's just they're just suppressing their feelings. They're not dealing with the root of what they feel. A lot of times I say, when you're not feeling well or you're sad about something, that's a symptom. You have to get to what the root of it is on why you feel the way that you feel.
Guys, thank you, Sade. Guys, I got the suicide hotline rolling across the ticker. We're going to always have that on this show. So, Sade, with that being said, well, let me tell everyone, this topic, depression, is going to stretch over probably about 3 shows because it's a lengthy topic and it's a lot to talk about. But let's get right into it. So with chronic kidney disease and mental health, Sade, they say CKD and mental health, chronic kidney disease affects how we think and feel. And then they go on to say CKD, chronic kidney disease, can affect every area of life, relationship, work, spiritual beliefs, and how we socialize with other people may all be affected. This includes our mental health. Many people have times where they struggle to cope and may become anxious or depressed. Is that, have you, when you practiced in dialysis as a social worker, did you see, was this common?
Absolutely. So like we can break those each part of that down. The first one you said was life. Life itself changes once you're diagnosed with a chronic illness, period. Your life is now affected. You have to get to know your new body, get to know your new baseline. The baseline that you had before is no longer what your body is now. You have to get to know what your new routine is going to be. So just like when you go on dialysis, your whole schedule changes, which also affects your work life, not only because you're tired, but it affects it because you may not have be able to work the same hours that you work, because we talked about chair times and things like that. So those things are affected. Your social life definitely can go down, because sometimes when people are sick, they hide it because they're embarrassed about what has happened to them. I know many people are afraid to feel vulnerable about things that happen, although it's completely out of their control. They don't know how people are going to react to them
Mm-hmm.
and their diagnosis.
Wow. And definitely relationships, CKD affects relationships. We've seen that a lot. I mean, I'm sure you've heard of uh, people, their loved ones leaving them, and in the midst of this going on because they may not able to deal with what's going on.
When it affects your mood, sometimes on both ends, sometimes when you're diagnosed with something so severe, you don't want to be bothered. You're trying to adjust to life for you. You're trying to adjust to this new form of life. And then your family is also affected because they may not understand exactly what you're going through or how you feel, or when you're tired, or mommy can't go and do all these things that she once did, or daddy can't do these things. Or even when it comes to husband and wives, the sexual relationship might change because of the effects of the kidney disease and a diagnosis.
Mm-hmm.
So that opens up a whole different can of worms of depression and self-esteem.
Wow. We must be on the same wavelength because I mean, literally, or next was coming up, it says mental health problems may develop because then it says adapting to CKD is stressful for the individual and family member. So, and that's what I was going to ask you. Someone could be dealing with depression and and mental health and have kidney disease and not even know that their family member is also dealing with mental health issues as well if they're not talking about it.
You talking about like the family member that like that like another member, like a
Like the
spouse,
caregiver in the house.
caregiver. Right.
Right.
The caregivers need care too, because their life everybody life's change when a diagnosis like that comes about. On the caregiver end, you have now transitioned over from, you're still a spouse if you are a spouse caring for your husband or wife, but it you transition more into a more of a nurturer. You have to be a little bit more understanding to what your mate is going through. So, and it's not sometimes anything that you are prepared to do. Sometimes you get like pushed into it. So when people's lives are changed so drastically, they have to learn how to adjust to the new norm. Some people
Mm-hmm.
don't know what to do, and some people really don't want to do it, Steve. There are some people that they don't want to do it. They're scared to talk about it. Like I have people that have come to therapy because they are caregivers and they're tired. They don't want to do it anymore.
Mm.
They don't want to do it anymore.
Wow. And what do you suggest to them? Because it could be somebody watching right now that could be secretly like feeling that inside. Uh, what would you suggest to the people when they do have those type of feelings?
I definitely believe that that is something that you definitely have to, of course, get therapy for and process
Sure.
your feelings about it. really be honest about what it is that you're feeling, because sometimes, like we talked about, is a root to it. Some people are affected because they feel like so much of their time is taken away from them. Some people are affected because they feel like the finances have changed and things like that. So it usually depends on what is connected to what the caregiver is feeling, or what is connected or what is happening to the caregiver, that helps you be able to process, or kind of dissect what's really going on, and then you start from there.
Now, here's another mental health problem may develop because some people with CKD may feel their body and general situations are out of control and there is nothing they can do about it. But in fact, there is something they can do about it, correct?
Yes. So depression. We know that chronic kidney disease is a high risk of people to experience depression. Depression is a mood disorder. That's what it is. Some people don't look at it like that, or they might not understand it. And what is a mood disorder? If we break that down, mood is the state of your mind. That's what mood means. And then a disorder is, this is like a part, and the order is something that typically functions a certain way. So when you have a mood disorder, that means that something is not functioning the way that it is in the mind, or your typical state. And when things are going on, or you're diagnosed with those things, or you have a lot of chronic illnesses going on with you, you sometimes feel defeated and depleted. Sometimes people don't want any additional help because they don't want to add another thing to their schedule. They're already going to doctor's appointments. They don't think that anybody can help them. But you have to be open to trying. See, if you do the same thing and you're not getting a different result, then you kind of have to help a person. You have to start where a person is. There have been many people that decided I don't think I really need therapy. Even when I used to have dialysis patients, they always said that they didn't feel like that they wanted to talk to someone. And the moment that they talked to someone, a lot of them felt a lot better. It may not solve it overnight, but it's a step into the right direction.
Yeah, share that. I'm just sitting back listening, boy. Like I'm receiving therapy too. I ain't gonna lie. I'm secretly.
It's good. It's a good thing. I tell people, therapy is a good thing. Therapists need therapists too. To have someone that is completely unbiased to talk to you about what you're going through, and you can tell your therapist practically anything about, like, the feelings that you have that you don't want to share with somebody is the things that you can tell your therapist. Like that's amazing. It's amazing. I encourage like everyone to get therapy. There are some people that get therapy just because they're making like normal life transitions, like they're scared to get another job, or they ready to retire. Like there are people that come to get therapy for that because there's so many other dynamics to it. So therapy is so beneficial.
Yeah, I ain't gonna lie. I've been to therapy, boy. I tell you, I almost been over the edge. So I'm not ashamed to say that. I mean, as long as I keep that in front, then that's all. I mean, that's when you keep it in the dark is when I think when you keep stuff like that in the dark, these dark secrets that you don't bring the light and to like let people know where you're at is when, you're in your house one day and you feel isolated. And that goes into the next problem that may develop the mental health, because we know a lot of CKD patients feel lonely and isolated from family and friends. Sometimes it can be difficult to talk about the illness with those close to us. We don't want to worry or upset them. Touch a little bit about that, because I'm sure that happens a lot.
I think that a lot of times we get into our own way, we get into our own head. So sometimes people are going through so many different things, and you're scared to be rejected, or you're scared to kind of be a burden to your family or whomever it is. So sometimes when it's time to talk to someone, your thoughts keep you from going to talk to someone that might be fully ready and capable of listening to you. So sometimes, like I said, we get in our own way. And is a vulnerability there. When you have to talk about to someone about something so deep, or to tell them your inner thoughts about how you feel about yourself, if you having some self-esteem issues, if you don't really want to live no more. Those are not the things that you want to say out your mouth. It's hard to say those things, and you don't want to be judged for it because you don't know what the response is going to be. That's another reason why people are scared to say something to family members. They don't know how they're going to react. They don't even know if they can even handle what you have to tell them. So it happens. It's common.
I was going to say, I can hear somebody trying to go to a family member saying that, you know, how they feel, and they say, man up, or something like that, because maybe they don't want to hear, huh?
Yes, you see that a lot. And you have to, I mean, have you ever had, there are sessions when you get family sessions and you have those people like that, like, no, I don't need this, I don't need that. And it's so funny because sometimes you have to break those people in, because even though sometimes a lot of people have really loud they're really loud about covering up their issues, but some of them have the deepest issues that there are. They push it down, they suppress it, and those be the people that are ready to explode. So yes, you do have people like, man up, you fine, you good, you nothing, you good, you're gonna be fine, you're gonna be fine. And sometimes people are not going to be fine. They need someone to talk to, and then they'll be fine after they talk to someone.
Mm-hmm. So I just want to say, for someone who may be watching this show right now who just started dialysis, or even veterans, let me just say, if you're going through a whole bunch of ranges of emotional responses, it's kind of common, because they say people with CKD and those who care about and for them can have a range of emotional responses: shock, sadness, grief, fear, anger, frustration, feeling down, tense, or alone. And sometimes many of these, I guess, in the combination.
Definitely. Like, imagine you go to the doctors, you're just going there for your typical checkup. Everything's smooth. Life has been fine, normal, your typical day, and you walk in to the doctor's office and you leave out with a chronic illness diagnosis that requires treatment. It's not even that it's something that you are diagnosed with and you can just deal with it in the comfort of your home. Now you have to go to a facility, or you have to get these surgeries to get these things inserted, and it's gonna, and if you do get it done in your home, you're at a higher risk for different things to go wrong in the home. Just all types of stuff. Like, that is how fast people's lives change. It's the
Oh, yeah.
eye.
Just like that.
Just like that. Just like that.
Wow. Now, so they say that some losses may seem relatively trivial, like limiting social engagements or shifting housework to a partner. Yet these can be important and may signal changes in relationships, such as greater dependence.
Yeah.
Have you seen a lot of that? Where maybe someone, like the husband or the wife, maybe were the breadwinner and they got affected with CKD. Now the roles reverse, where now say the husband was the breadwinner, now he got to depend on dialysis, and the wife got to take him, and maybe he may have to limit his work time because other problems may come into play. Have you seen that in your practice?
Yeah, definitely. So for what they're talking about, like on a trivial scale, it's so important for the details of that, because some people look at it like, oh, that's not that serious. Just ask your husband or your wife to just do the dishes, or ask your husband or your wife to just wash the clothes this time. But a person can feel so many insecurities about that because that was their task. That's the things that they used to do. And people start to grieve the life that they had on those things that are small because that's what made them them. That was a part of their independence. So sometimes, people say, oh, you never miss anything till it's gone. Those are the things that people that are diagnosed with chronic illness start to remember. They remember what it was like
My
to
God, are we reading off the same paper? Are we right? Are we like this?
that spiritual alignment be there for me.
No, I mean keep going because I want to tell you something once you finish.
So those are the things that are important to people. They seem trivial to others because they're like, oh, I don't want to do dishes, but that's because you have a choice. See, when your choices are taken away from you and when you can't do something, that's when you start to require dependency and you aren't able to be independent like you were. So independence is very important to a lot of people. That's why when people are getting older or they're transitioning to like elderly ages, they sometimes grieve because they're losing their independence. When you are diagnosed with a chronic illness and you aren't able to do the things that you once were doing before, you feel like you're losing your independence.
Wow, and it's just real ironic that you said that because literally the next thing is grieving for previous health. And they say many people also talk about grieving for their previous health, abilities, and their life before CKD.
Yes, that is huge. That is
And I
huge.
was going to say, and I got a question next to it because here go my notes right here, right? And I got a question next to it like, have you encountered that?
Yes, that's my specialty. That's one of my specialties right there. I help a lot of women that are grieving, and men too, that are grieving the life that they once had before certain things happen. Like, of course, I do with the pregnancy complications and things like that, but
Right.
definitely like chronic illness and things like that, because grief and loss is something that a lot of people associate with just death. And I'm like, no, you can grieve so many different things. Grieving the life that you once had is so serious. The stages of grief are denial, anger, bargaining, um, depression, and then acceptance, right? So when you are diagnosed with a chronic illness, the first thing is like denial. That's the shock that you mentioned. Like you're shocked. You're like, this can't be it. I was just fine. Like sometimes people feel fine when they're diagnosed with something. That's why so many people be like, you're not going to put a fistula or a catheter in me. Like, I feel fine. I didn't sometimes they're like, I didn't know that I was like something was wrong. So that initial diagnosis is like a shock and you are in denial. Then the anger comes. That's when people get pissed off. Now they mad. They mad that this happened to them. They don't understand why it happened to them. And that goes into that area where you always do, Steve, when doctors don't inform people or they're not getting the proper nutrition or treatment that they should get before they even get to that point, And then you got the bargaining. Now a lot of people want to bargain with God. They're like, wait a minute, if you just give me my health back, if you just like give me another chance to do this over, what can I do? How can I fix this? And then they transition to that depression because things start to settle in. Now you kind of know that this is what it is. This is what I have to deal with. This is what I got to adjust to. So they get depressed and they get into a state of just sometimes it's just a state of sorrow. Like they're seriously grieving what once was. And then the acceptance part is when they finally accept what has happened. It's not that you agree with what has happened. It's not that you think that you deserve what has happened. You just accept that it has happened and you deal with it from there. And then with the stages of grief, you cycle because it's chronic illness. It's long term. There are things that's going on with it. So sometimes you get to acceptance and then you might have a bad day. You don't feel like being bothered with something. And then you go back
You go
And
back through that cycle.
right.
So anywhere in that cycle, like say the bargaining stage or the shock stage, can you be in that stage for a period of time? There's no
Yeah.
like,
Sometimes people can be in that stage for months and dabble out just for a second and go right back into the stage. You can be in that stage for sometimes you can be in that stage forever.
mhm. So again, we must be on the same spiritual wavelength because even though I mentioned grieving, it goes in and says grief can look like it goes one, shock and denial. This can't be happening. I just need some rest. Two, anger. It's not fair. Why me? I hate you. Then fear and anxiety. What will happen? Then feeling down. I don't know if I would be able to cope. I'm so sad. And then bargaining. I'm telling you, I don't know what's going
I
on
hope people
tonight.
don't think we rehearsed this, Steve. We really didn't rehearse this,
No,
y'all.
we didn't.
We really
And
didn't.
then bargaining. Please, God, I'll stick to my fluid restriction if you make this better. And then acceptance. This is not going to go away. So I should start to work out how to manage and enjoy my life with it. I mean, you pretty much, I don't know what's going on, Sade, but this must be needed tonight. No, seriously, because maybe a lot of people who's watching this don't know this and may
Right.
not understand the process. And if they're feeling these, they may think it's something else. And if we can just put this information out there, maybe they may see something from a different perspective.
Absolutely.
Uh,
Absolutely.
and then it says, Sade, these feelings are natural
Mm-hmm.
and very common. And it's important to recognize and acknowledge them. Speak on that.
You're for one of the biggest things I have to remind people is that we're human. We're human. We have emotions, we have feelings, we have desires. Um, Period. That's just what it is. So it is natural. It is a natural response for someone to be upset or shocked about something like that happens. It's just it's a part of the process. That is something that I don't know who would be diagnosed with something unexpectedly and would respond any different.
Mm-hmm. 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 Wow. Now, then it goes on. For some, because we know not all, but for some, the emotional impact can feel overwhelming. It can leave people very anxious and depressed. It
Mm-hmm.
can stop people from doing the things they need to do in their daily lives and from taking pleasure in things we usually enjoy.
Mm-hmm. You ever had one of them days you just don't want to get out of bed? It's not even necessarily anything that's going on that is different from what has happened, but it's just the thoughts and stuff that are in your head. You could have been on dialysis for 10 years and you just have a really bad day and you're feeling like you just don't want to do this anymore. You really don't.
Mm.
Or you having a bad day where you just don't feel like going today. And then you start to think about how you just tired of going on the other days. And then you think about how you just don't want to sit there that long. And then you get all of these negative thoughts that just pile up in your head. And next thing you know, you are wore out. You've been in this big old fight inside of your head and nothing else has happened. You just can't do anything. It totally diminishes your mood. You don't want to eat. You just want to just sit there. Those are the things
Mm.
that start to they can be debilitating sometimes when you sit there and you have to just kind of deal with what's happening. So that's why a lot of times you try to stay positive, you try to think positive, but you're human. You're human. And it's okay to have a moment like that. Sometimes a moment like that you'll have every now and then, maybe like once every few months. You have a moment and then you get back on track. You get yourself back to where you need to be. Or you talk to your therapist about what you've been feeling and they help you get back on track. That's the importance of having support. Having a strong support system is very, very important, because when you don't feel like going anymore, your support system can kick in to help you go.
Right. Wow. Absolutely. Absolutely. And now, so depression and anxiety, we're starting to move into the depression part. Like I said, this is going to be a 3-part show. So, guys, we hope you getting some great information. Sade, I mean, you're awesome. I mean,
Thank you.
again, if I ever had to go back to see a licensed clinical social worker, come to sit on your couch.
Right.
No,
That's fine.
yeah, awesome. So depression and anxiety are very common with CKD. Then, so someone's diagnosed, maybe let's just say maybe 80%, maybe it could be just a little bit more. I don't know. 80%. I'm just going to just throw that out there. Maybe 80% of people who get diagnosed with CKD will experience depression and anxiety because it's very common.
Mm-hmm. Mm-hmm.
And I mean, it says depression and anxiety are very common with CKD. They can appear in people affected and in those who care about them through all stages of CKD, from diagnosis to dialysis, following transplantation, and even decide not to start or to withdraw from dialysis. Talk a little bit about that.
So definitely, depression is very, very common with CKD. So common that the governing body, which is like CMS, has required social workers to give the depression screening, which is known as the PHQ-2 test. And that is basically to gauge if your patients are experiencing depression. It's a questionnaire. It's a scale basically to help determine that. What was the other part that you said, Steve, about that one? The other part? I can't hear you, Steve.
Oh, I'm sorry. It said depression and anxiety are very common with CKD. They can appear in people affected and those who care about them through all stages of CKD. So even from 1 to 5, from diagnosis to dialysis, following transplantation, and even in deciding not to start or to withdraw from dialysis. So let me just ask you this with transplantation. You would think someone who gets a kidney will be elated. Why would they experience depression and anxiety after? I mean, I know it's all kind of reasons, but what would be the common reason? Wouldn't you think? I would think that someone would be really happy that they got the transplant and they don't have to deal with dialysis no more. Why would depression and anxiety creep in?
Well, a lot of times when you get a transplant, you're on medication for the rest of your life, or the rest of the time, of course, that you have the kidney. So that creates anxiety for people. A lot of people fear that something will happen to the kidney now and that they may have to go back on dialysis. That's where the anxiety starts to come in. A lot of people are just sometimes when you're diagnosed, it's trauma. That's the best way to describe it. It's a traumatic experience. Even though you went through a surgery, you've received a kidney and things like that, it does something to your psyche, all of the stuff that led up to it. So it is an enjoyable moment to be able to be transplanted and to not have to go to dialysis. But now you're entering into a whole different life. You're still not going back to your normal life. It's still not back to the life that you once had. Now you're getting adjusted to the life of taking care of a new kidney. You know what I'm saying?
Absolutely.
You still got to take those medications to make sure you do what you're supposed to. You still got to be careful with certain things. You definitely want to make sure you're eating right with your diet and things like that. You want to preserve this kidney as long as you can. And sometimes people are projecting to the future because they are scared to lose the kidney.
So what would you say to someone who was in that position? Like what would you say to someone who may get may have some type of panic or anxiety attack each time they go and do their lab work because they may fear that it may show something that they don't want to know about, like possible rejection.
Those are when you start to get into your therapeutic interventions right there, like your cognitive behavioral therapies, your a lot of your different like techniques that you go. So once you assess a patient or a client and you see where they are, you kind of like take it from there. You try to help them live in the moment now. It doesn't mean that something's going to happen to you. Just because sometimes people are like, well, this happened to my friend. That doesn't mean that that's going to happen to you. Some people say, oh, I know somebody that had a kidney and it didn't last for the 10-year expectancy that we thought. It only lasted for 2 years. So I'm just nervous. I'm coming on my 2-year mark. So you kind of like help them try to reprogram their thoughts to positivity. You try to help them dismantle certain beliefs that they have. And sometimes you really have to go in to help people kind of like go away with what they once knew. It's like you kind of yes, you're really kind of like you're rebirthing a person. You're helping them become that new person. You're renewing who they are. This is what is now, and this is what can be from this. This is what can happen if you do these type of exercises. This is what can happen if you exercise these type of things.
Mm-hmm. Mm-hmm.
And it also goes into a lot of spiritual stuff. A lot of spiritual belief comes into that about having faith, about praying and things like that. So that's a lot of things that start to come up for people too when they experience anxiety, when they want to go down that route. Their spiritual beliefs, their faith-based beliefs, those things help a lot with people too.
Now, it says these feelings are normal and it is helpful to talk about them with people who cares about us. While they are unsettling, it is important to remember that each of us has the ability to learn new coping skills. See, I'm telling you, we must be on the same wavelength because you was talking about reprogramming and new coping mechanisms to new coping skills and develop relationships with individuals who can provide support. My question is, if the literature is telling people that have CKD that these feelings are normal, why isn't more people talking about it? Well, why aren't more people who's affected with CKD and possibly mental health talk about it if we have like shows like this that talk about it, or society has, well, not all society, but I guess the stigma is kind of being lifted a little bit.
I think people still at this day and age, sometimes they just lean to their own understanding. They feel like it's something that just will pass. They feel like, oh, I'm just feeling down right now. It'll go away. And then when it doesn't go away or it spirals out of control, they finally feel like, oh, I can't control this or I can't handle it. I need help. That stigma is a very, very strong stigma that is still out there, and it cripples a lot of people from getting the help that they need. Some people don't know where to look. Some people don't know how it looks like. Some people are just even fearful about just being diagnosed with anything else. Some people are like, I don't want to be diagnosed with something. I don't want people to think that I'm crazy. And it's not even that you're crazy. It's just that you're going through something. It's natural. This is what happens. And although the literature is telling people that it's natural, people don't feel that it's natural. People are comparing themselves with their old selves. Oh, I never once felt like this before, but that was when you were at a different baseline. That was who you were at that time. This person that you are right now needs a little bit more support. It needs a little tune up. Just need a little tune up. That's all. That's all.
Wow. Now, it also mentions that depression affects around half of those affected by CKD at some stage. So not everybody who has CKD is going to have depression.
Mm-hmm. That's true. Some people are able to, even if they had it at some point, it might not be ready to be clinically diagnosed, if that may happen. So some, like I said, mood is a mood disorder. So some people have a mood and some people have depression, but it might not meet the actual criteria of it. Like it might not meet a time frame on it because they were able to get out of it on their own, which is normal too. Some people really can get out of it on their own. It didn't affect them or impact them like that. It doesn't mean that it can't happen down the line. It might mean that they just cope and adjust with things differently. Some people do fine at first and they're still in a state of denial. They just going along in emotions. Sometimes they feel like they're in the matrix. And then next thing you know, maybe like 7 months later, they might be having a episode or something like that. And then they go get help. And some people literally have an episode right when they get diagnosed. So everyone's different. That's why it's called individualized treatment when we're dealing with mental health, because you never know what you never know what really is the root of the issue or how it's affecting the person.
Mm-hmm. Now, wow, this is crazy how what you're saying just kind of segue into what I'm about to say. Wow. Now, it also talks about around half of all family members will also be affected by mental health problems. This includes children, teenagers, adults, and older adults. With that being said, so if someone, is on dialysis, the mom, the dad, and they have kids, say in middle school or high school, and the literature is saying that around half of all family members will also be affected by mental health problems. If it's not talked about, how will we know if a situation at school or some type of unwanted behavior from the teenager children may not be associated with the person going through kidney failure? They may look at it, them acting out because of something else, or say it's growing pains, or they're just being teenagers. How do we know that it may not be tied into their parent having kidney disease?
That is the importance of seeking mental health treatment so you can get an assessment. Remember when I spoke about the symptoms? So if a person or a child is acting out and having some behavioral issues and it looks like they're just doing something or doing whatever and it's not a typical behavior, when you go to therapy or you get the mental health treatment that you need, that's when you do the assessments and you find out the root of the problem. So the behavioral issue is a symptom. The person is acting out for a reason, and then once you take them to therapy, you do your assessment, you do your therapy, you get your interventions and things like that in order, you will be able to tell or determine where it's coming from. And that is the importance of getting mental health treatment. That's where you find the source of your problem.
Mm, right, but I'm sure a lot of families will fall through the crack.
Yes, absolutely. Absolutely. And that's when you find out how when people come in and they like at later times or when they're older, they talk about the childhood things that affected them, childhood trauma. That's why a lot of people have to get psychotherapy, because you have to go back into the things that affected them. Like people tell you all types of story. My mom was diagnosed with this and she wasn't able to do this, and I had to start working at a young age, and ever since then I just never really asked anyone for anything. Or this happened and I was worried about how I was going to eat. I mean, you get so many different stories. And a lot of times, because people don't know about therapy, or people have a stigma about therapy, or people are afraid to kind of dive into the mental health piece, those wounds go unhealed.
Mm, wow. So let's talk about depression and how can also be a result of physical changes. And then next week, we've been on here almost an hour, but next Wednesday, when we're going to get into what is depression. Even though you said it, we're going to get into what it is. I heard it's a different. It's
A lot of different types.
Yeah, different types.
Mm-hmm.
And anxiety, some anxiety disorders that are common with people with CKD. But it also talks about that depression can also be a result of physical changes. Some depression symptoms may be the result of physical change, not just mentally, but now physically caused by kidney failure, such as anemia, the buildup of waste products in your blood can also cause changes in behavior. Wait a minute. Where did I go? I'm sorry. Yeah. The buildup of waste products in your blood can cause that. But even like getting cut on your arm or any type of physical changes, that can also lead to depression as well. Can it, Sade?
Yeah. Sometimes depressions can be medically induced. Like something happened medically and it caused you to have a mental effect. So a lot of times, like you said, like a person getting cut on their arm, like a fistula or things like that, that can cause depression because it's associated with their body image. They don't want it there. They don't like it. It doesn't look pretty. And I know you being a nurse, you see how sometimes they look really like they can get really big and things like that. That has been a lot of complaints that I had from patients before too. And it makes them want to wear long sleeves during
the aneurysm.
Yeah. So that right there is another life altering change because now I have my physical arm. I don't want to show it anymore. And now I'm like wearing long sleeves during a time that I used to could wear short sleeves. Those are the things that people would think wouldn't affect them so greatly, but it does. It changes their life. And then the next thing that happens, if you do decide to have the strength from going to therapy to show off your arm, you got to be prepared to know how to answer the questions because people might ask, well, what's that? What's that on your arm? So you see how
and that would be like constant reminder.
Yes. So it is a process to be able to really deal with the changes that come with chronic illness.
Yeah. And a lot of people may not know that when I talked about the buildup of waste products in your blood, like if you got a catheter, you're getting a shoddy treatment, or your blood pump is turned down, your access is messed up, but you're not getting good clearances. That can cause changes in behavior and include irritability, edginess, moodiness, memory loss, and confusion. Some people refer that to dialysis brain fog, and also problems with sleeping, resulting in fatigue, low energy levels, depression, and anger. When people talk about insomnia.
So when it's medically induced sometimes, so that's one of the things that you always assess for too when you are a clinical supervisor, a social worker or any type of mental health professor or profession. Because when people come in and is affected by their medical state, you want to try to get their numbers under control because you could be treating the depression, but it's not really going to change because it's medically induced. So if you have like waste buildup and all those other things that contribute to depression, me helping you cope with depression is only going to just be like a band-aid. It's not going to do much for you because it's medically induced. So the medical part needs to be handled for us to be able to do the other part.
Wow. Man, this has been a great hour. It's been a great topic. Like I said, we got Warriors Quest coming up at 8:30, guys. But next week, we're going to continue this topic of depression and chronic kidney disease. We're on every Wednesday at 7 p.m. Eastern Standard Time, USA. So what you think, Sade, for the first show?
Really good. I'm so glad I was just so in tune with you.
Oh, absolutely, absolutely. And I just hope we're able to help someone who may be, dealing with something. They can look at the
Yeah,
information in a different way and decide to seek treatment if they
absolutely.
need to.
Absolutely. And just understand that like we're here and any questions that I can definitely answer, I'm open to answering them. I love mental health, all things mental health. So just
Oh, it shows.
thank you.
Yeah, it
Thank you.
definitely shows. So before we go, just put that plug in about MEI. And again, just touch a light of what you do in that business.
So, MEI, like I said before, is my empowering impact, and we provide mental health and wellness. We are here for therapy. We do some coaching, and we are teaching other social workers and clinicians how to, do what they need to do in the field as well. So we're
Right.
here, and we're ready to help.
Yeah, there she go right there. MEI, My Empowering Impact. Check them out on Facebook. I'm telling you, you're not going to find any. Well, let me not say that, but you're not going to find any social worker like this devoting her time and giving back to the community, such as Sade. I haven't seen any on there to commit their time. So I thank you, Sade, for
You.
committing to come on every Wednesday at 7, taking the time, an hour out of your schedule to do this. I know you're a mother, you're business owner. So thank you so much for taking the time out.
Oh, you're welcome, Steve. Thank you.
Yeah. So what you got planned for the rest of the evening?
Um, Nothing much. I think the debate come on tonight, so I'll probably try to catch that.
Oh, which one?
I'm not. I thought the vice presidential debate
Oh,
was
it's the vice
tonight.
president. Okay. I
Yeah,
don't watch the news like that. So I
I don't
thought,
watch the news, but I'm just kind of interested in this debate. I'm just curious. Just
oh, absolutely. With Pence and
or
Kamala Harris.
Kamala.
Kamala
Hmm.
Harris. Okay, okay.
Yeah, yeah, yeah.
All right. Any shout outs you want to give out before we go?
Um, Not really. Well, we'll be here every week. I'll think of one next time.
Right, right. All right. Everybody, thanks for watching Mental Health and Me. I'm Steve Belcher.
And I'm Sade Cutler.
All right, guys. Have a great evening. Again, tune in at 8:30 for Warriors Quest with Jared A. Brown. It's going to be an awesome show. Thanks again, guys. See you, Sade. Talk to you soon.
Okay. Bye bye.
All right. Bye-bye.